So coronavirus has profoundly affected the way that we work since March of this year. I work at the Western General Hospital, which is a teaching hospital in the northwest of Edinburgh, and we are home to the Regional Infectious Diseases Unit. So, the very first patients in Edinburgh to be hospitalised as a result of coronavirus infection were hospitalised at the Western General. And we, as an intensive care unit, had to generate plans to both admit and cohort these patients safely within our intensive care unit to be able to provide them with advanced ventilatory therapies in a way that didn't risk the health of other patients and staff. And we also had to make plans with relatively little notice on how to expand our ICU capacity to at least 3 times its normal capacity at the request of the government in anticipation of a surge in the number of cases of patients needing to come to intensive care. So that happened in March 2020. And over March, April, May, we filled our normal intensive care unit with intensive care patients with coronavirus infection, and we had to expand our intensive care to a separate area of the hospital in the theatre suite, the recovery area, which is where we kept our non-coronavirus patients, because at that time we were a neurosciences intensive care unit plus all the other specialties we looked after, and we still had an ongoing need to provide intensive care to patients who were not infected with coronavirus. But that had the knock-on effect of affecting the throughput of patients coming through theatres having emergency and elective operations. And the increase in number of beds, which was well over 50% of what we normally provided, meant that we had to draw medical, nursing, pharmacy, physiotherapy, speech and language, dietetic therapy staff members from all over the hospital to look after these patients, which was possible because of the slowdown in clinical activity in other areas of the hospital, but led to its own challenges in terms of teaching, training, and staff well-being for these people who were not used to working in a critical care environment, having to do so with very short notice, and the physical constraints of PPE and so forth.